am the administrator and co-owner of Cohesed Home Care and also serve as the board president for the Rhode Island Partnership for Home Care. Thank you all for being here today.
Thank you.
26 years ago, the partnership was established, a group of thoughtful local leaders within the home care provider community that were committed to advocate for the needs of providers, their staff, patients, and clients. Today, the partnership remains as the only association in Rhode Island dedicated to advancing quality health care at home. The partnership represents home care, home nursing care, and hospice provider agencies licensed by the Rhode Island Department of Health to serve patients and clients in every Rhode Island community. As providers, we are committed to promoting quality home health care service delivery, ethical health care business practices, and positive patient and client outcomes to ensure the access of home care and hospice remains an integral component of our state's post-acute and long-term health care system. Last year, as we have in previous years, we were here at the State House to promote the quality care provided by our member agencies and advocate for a much-needed rate increase. Unfortunately, we suffered another year of frozen Medicaid reimbursement rates. Today, we are back with louder voices to advocate for our member agencies, staff, and clients for the much-needed Medicaid rate increase. We are at a crisis point. Agencies that cannot survive are closing. The ones that are still open are struggling to maintain operations under new unfunded federal and state mandates that have exceeded the reimbursement rates provided by the Rhode Island Medicaid program. Our direct care staff continue to struggle to make ends meet under current wages, and they are making the choice to earn better wages in nursing homes, hospitals, or to leave the healthcare industry completely. As a result of the current fiscal policies, we are losing caring, compassionate, and talented caregivers at a time when there are so many Rhode Islanders in need of our services. However, the resources are just not there to provide them care. In my business alone, and I know that every agency here can share their own stories, the past year has been filled with caseworkers calling time and again to plead with us to take Medicaid clients that they cannot find an agency to provide services for. Because of high staff turnover rates and more Medicaid clients having complex health care needs that exceed what the state provides us to deliver quality care, providers can no longer afford to take these cases without the threat of having to close our doors. In the current business climate, without corrective action now, more layoffs of our staff will come, more Rhode Islanders would go without care, and more of our businesses will close. Our goal for this event is simple. For all of us who are here today, we need to educate our representatives and senators about the value of home care and inform them about the repercussions of not resolving the financial crisis for delivering health care at home. Today does not begin and end our conversation. We need all partnership members, their staff, patients and clients, family caregivers, family and friends to continue the conversations with their state representatives and senators until this issue is resolved in a way that ensures the access to health care at home is sustainable. With that said, I'd like to introduce Leanne Quinn from Beata Home Health Care Services, and her son Zachary is up top there, and she's going to talk to you about her story and Zachary's story. Thank you, Leanne.
Thank you. Not only am I the mother and proud mother of a 17-year-old senior at Cranston West High School who happens happens to have Duchenne muscular dystrophy and has been unable to walk since he was 11 years old. I'm also a nurse and a clinical manager at Beata Home Healthcare. And I'm a granddaughter to another one of our clients who happens to be 94 years old. My son Zachary has lived with Duchenne since he was 5 years old. It is a progressive neuromuscular disease, and it has, over the last 7 years, taken away his ability to walk, to run, to feed himself, to get up, to be able to use the restroom on his own, to write at school, or basically do any of the things that all the rest of us take for granted. Zachary has a one-on-one aide every day at school, and because of home health aides and the wonderful, compassionate CNAs, he has 48 hours a week of home care in my home, providing services to get him up, dressed, and ready for school every morning, to get him ready for bed every evening. As a nurse, it took me about 3 extra years to decide to allow somebody else to come into my home to care for my son. But it became too much for us to no longer be able to just be his mom. And as many of you know, not too many 17-year-olds want their mom cleaning them up. Nor do they want them feeding them. They want to be independent. And the best way to provide that was for my husband and I to break down and to decide to let somebody in to do it. And we have wonderful staff in my home. About 5 different caregivers provide services for him. It was because of these caregivers, my husband and I are both allowed to work full-time jobs, to care for my 3 other children who are perfectly healthy, and to basically just live our lives, to go places every day. It's a really sad day when one of my home health aides comes into to my home and says, "Do you know they're paying $10.25 at McDonald's, and they don't have to do any of the things that I do?" Amen. If I don't have the home health aid services that currently are being provided by the state for my son, it's going to be very difficult for him to continue on to go to college. It will be difficult for me to continue to be a full-time working member, and it will be even more difficult for me to just be his mom, which is exactly what every 17-year-old wants. He needs to stay at home. I will not put him in a facility. And over I have heard from so many, including some of the state social workers, when we have conversations about needs and increasing hours, we hear over again, if they need that much help, they belong in a nursing home. No, he does not. My son and every other person in the state of Rhode Island deserve to be home with their families, with his brothers and sisters, growing up, going to college, and having a life. I see this every day, as Lori spoke of, social workers calling the office asking for help. I see it every day in the care of my clients when I go and they ask for more staff. Can you help me out with more hours? And I don't have anybody to send them, and I say that to them all the time. I'm sorry, we just don't have the help right now. We're really working on it. We're trying to have a lobby day. I don't want to say that to my clients anymore. And I also have a 94-year-old grandmother who received 20 hours a week of home health aid services. She is a spunky, independent woman who needs some help. She doesn't belong in a nursing home, but she can't stay home by herself. And if we don't have the help coming in, my uncle, myself, my mom, all who work, aren't available during the day to field her phone calls and to provide all her needs. But having that home health aide there gives us the ability to have her taken care of during the day till we get out of work and we can take over to provide the services that she needs. I can't stress enough how important every one of the CNAs that come into my home, that work with me as colleagues at Beata Home Healthcare and throughout the state, I would give them all the money in the world, because the service they provide is absolutely invaluable and worth so much more than we are currently able to give them.
Leanne, thank you so much for sharing your family's story. As we operate our agencies, we have a voice here at the State House advocating daily on our behalf. It is my pleasure to introduce the Executive Director of the Rhode Island Partnership for Home Care, Nicholas Oliver.
Thank you. Before we get started, how many of you have Facebook or Twitter accounts? Citizen advocacy in the 21st century has moved to social media. Do me a favor. When you go on your Facebook or your Twitter or any other social media, use the hashtag #SaveRIHomeCare and let members of the General Assembly, at RI Senate, and at RI House of Reps, and even find the governor on Twitter and Facebook, and let her know that it's your priority this session to hashtag #SaveRIHomeCare. So, before I begin, let me just thank all of you for attending today. This week is National Volunteers Week. The partnership is a small but mighty organization, as you can see here. We do not have the resources to contribute thousands of dollars into campaign accounts into our local politicians like our friends at the hospitals and the nursing homes and the other big industries here in our state. But what we lack in PAC money, we have dedicated people that are willing to come up to our house, the people's house, and advocate for health care at home. I want to thank our patients and clients, many of whom are otherwise homebound, that have joined us today along with their family and friends. Most people do not understand the effort that it takes and the resources that it takes to transport some of our patients out of their homes and into this building. Again, thank you so much. In addition, I'm appreciative of the work of our home care and hospice nurses, our CNAs, any of them here? Our social workers, homemakers, therapists, and other professionals that all provide quality health care in the homes of Rhode Islanders every day. These folks are angels on earth. I know that most times you feel that you're in thankless positions, but please remember that I will always thank you for your service, and it is my job to remind our elected and appointed officials to consistently do the same in their words, in their policy actions, and in their votes. What many of you may not know, and for those that are watching on television may not be able to see, that there are a number of dignitaries that are around the second floor of the State House. I want to thank you for hearing our voice and for your support for home care and hospice. Let's give them a round of applause as well. Let me also thank Lori, President of our Board of Directors, Leanne, and her son who's upstairs, who couldn't be with us here on the half floor here because he is wheelchair bound, but her son Zachary, for telling their story and setting the stage for why we are here today. Your words demonstrate the utter frustration of an 8-year Medicaid rate freeze. Many of you have signs that demonstrate that frustration. You may feel ignored by your elected officials now, but they will not ignore you after today. Lori talked about at the beginning of her presentation on how we come up here year after year after year and we seem to have the same message. So too did I struggle on my message today, and trying not to necessarily repeat the same message. Although we want our message to be heard, the issues are the same. But during this event each year, I like to point out my own state representative, because of the relationship with him is a lesson in be kind to others, because you never know what the future holds for that person and how you may meet up with them again. You see my state representative up there, Greg Amore, who represents the Kent Heights and Riverside section of East Providence. We've known each other since, well, I won't tell the year. It starts with 19. I don't want to get either of us in trouble. Anyway, in 19-something or other, when I first met him as a student at East Providence High School, any townies here? All right, townies. It was in his high school history class. Fast forward to today, he is ascending into coveted positions here at the State House, including the House Finance Committee, where budget decisions are made. And I have the opportunity to lobby him and his peers on our behalf. Thankfully, I got an A in his class. But I hope that we consider each other friends today. Again, you never know where the future holds and in what capacity you interact with people. Maybe one day the folks that work here at the State House may need you, home care and hospice workers, for their loved one or even themselves. So help take care of us today, because we want to be around to be able to take care of you tomorrow. So I tell you the story of my relationship with now Representative Amore because I rewind back a period of time when I was sitting a student in his class, and he would always start the class with his take on events in history on this date. So in honor of this, I want to share with you an on this date in history that might have been mentioned to his students in his classroom today. Today marks the 71st anniversary of a sad day in American history. On this date in 1945, President Franklin Roosevelt died in office. For many that work here in the State House, FDR is likely one of their political heroes. This president created many social programs that helped this country out of the Great Depression and got Americans working again. Many of these social programs had funding to keep services needed to create an economic engine that improved our quality of life and advanced our nation. FDR became the great American president that many in this building regard and have helped shape their own political ideology into the bills that they file, the public policies that they support, and the votes in which they cast. You see, President Roosevelt did all of this while in a wheelchair, disabled, and at times needing support for activities of daily living. Granted, this was all before Medicare and Medicaid was developed in 1965, and which we were proud to celebrate the anniversary of Medicaid and Medicare last year. However, I mention this because one of our most notable presidents wanted to see Americans receive the help that they needed, and if achievable only a generation prior, I believe that he would have wanted Americans to receive the same type of care that he received in their time of need. With that said, seeing some of your signs, I want to briefly address the elephant in the room that motivated you to participate in today's events. In the governor's proposed FY17 state budget, she proposed a small wage pass-through to support direct care workers in home care. All of you are upset. Some of you have even shared that you feel insulted. You feel frustrated by this proposal because agency administrators contracted with the Medicaid program can no longer afford to add another unfunded mandate to the litany of other federal and state mandates that are impacting providers' ability to deliver quality home health care since the last wage pass-through in 2008 before it was cut in 2009. Under our current reimbursement rates, agencies can no longer afford the increases in medical equipment and supplies, utilities, rent, property insurance, workers' compensation insurance, malpractice and professional liability insurance, and payroll taxes. Not to mention the overtime and travel costs compliance with the employer mandate under Obamacare. Because all of these factors impact the total cost to deliver health care services, none of which were factored in the governor's proposal, many individual agencies have testified in person or in writing that they can no longer afford to comply and will be subject to Secretary Roberts' proposed clawback. Thus, this small proposed wage increase, as structured, may never reach direct care workers as intended. Now look, call me naive, but I do believe that Governor Raimondo and Secretary Roberts intended not to cause further irreparable harm to already financially struggling and fragile Medicaid home care agencies. I'm willing to assume that they had the best of intentions to offer financial relief to home care workers and empower many of you, those that are women, ethnic and cultural minorities, and single moms. The targets for many of the administration's empowerment initiatives. However, even if you do see this small increase, will you feel empowered if you're still living in subsidized housing? No. Will you still feel empowered if you're using your SNAP benefits? No. Will you feel empowered if you or your children are still on right care? No. How about the agency administrators, many of whom are women-owned small businesses? Do you feel empowered when you have to tell your dedicated home health aide that the reimbursement rate still will not allow you to offer benefits, wage increase, competitive wages to keep them with your agency? No. Do you feel empowered that you're struggling to keep your agency afloat with continuous unfunded mandates and initiatives to improve quality care, but are mischaracterized as program integrity? No. As I said earlier, this pass-through is not a new idea. It was adopted in 2002 and again in 2008 without any regard to the total cost of care. Back then, we were not at a crisis point. Those that needed care received it. You always found a way. Now that people are regularly denied access to care because of where they live or the level of care in which they need, many end up waiting way too long to go on services and find their way into the emergency rooms or the nursing homes that are more expensive on the state's dime. Or they pay the ultimate price before a state caseworker can find them care. Don't ask me, just ask your local CAP agency. You see, these pass-throughs are an old, failed fiscal policies from the days of Governors Almond and Carcieri. Repeatedly denying access to care and either purposely or inadvertently closing home care agencies under significant financial stress is not reinventing Medicaid. We ask that Governor Raimondo listen to home care workers and the agency administrators here today and across the state to work with us to go back to the drawing board with this proposal and develop a plan that works for all parties. If not, then I respectfully ask Speaker Mattiello and Senate President Paiva-Weed to show their leadership and stand up for all those that need home care and hospice and resolve this issue this session. You see, my friends, we're at a crisis point. In reality, the denial of access to home care is essentially Rhode Island's version of the national VA hospital crisis. Except this is not just impacting veterans, it's impacting all those that are disabled, sick, and dying, especially our oldest and poorest Rhode Islanders. We know that Governor Raimondo wants to leave a legacy of reforming our health care delivery system and ensure that direct care workers are compensated appropriately, for their work is not near minimum wage work. Governor Raimondo, Speaker Mattiello, Senate President Paiva-Weed, we need to move away from the Almond and Carcieri era, and we want to work with you to get our state out of this crisis now. When I think about FDR and his vision for our nation, I can't imagine that where Rhode Island's home care and hospice crisis is today is what he had envisioned. It's an uphill climb to correct the mistakes of previous administrations. We recognize that. But we have to start with something that does not further hinder access to care and access to quality health care at home. Our staff deserve a competitive wage. Our staff deserves to earn competitive benefits, including access to the same quality of health care that they provide in every Rhode Island community. And in every Rhode Island community, every single day. You see, my fellow Rhode Islanders, this is not just a health care issue. It's not just a Medicaid issue. And it's not just a state budget issue. Home care is also a jobs issue, which is the centerpiece for why many of our elected officials ran for office in the first place, to help their neighbors and their community become more productive citizens by ensuring that they have a steady paycheck that provides for their family and improves their quality of life. It's the American dream. It's time to include home care workers in the American dream. We want our direct care workers to have steady jobs and a steady paycheck that provides for their family and improves their quality of life. We want our patients and clients to know that the CNA or the nurse or the therapist that visits them today will be the same one that visits them tomorrow. They deserve continuity of care, but that cannot happen with the revolving door of staff and home care agencies operating on the brink of financial collapse. That is why this is a jobs issue, and we cannot afford to dust off old playbooks that got us into this disaster to begin with. We must fight to bring back access to quality health care at home for all Rhode Islanders in need of our care. So let's roll up our sleeves together. We're willing to work with this administration, and we're willing to work with this General Assembly. Combined with their leadership and our knowledge of the home care and hospice industry, we can finally begin to rebalance our long-term care system toward home and community-based services and supports with an investment into home care and hospice agencies and our staff. We can begin to reverse the access crisis and grant the agencies the financial reprieve that they desperately need to stay operational, especially when we know the services will not be available for baby boomers and subsequent generations in need of our care without resolution now. Thus, we need to put a pinhole on the plethora of labor bills that put the final nail in the coffin on all home care and hospice agencies, not just Medicaid providers. Instead, it's time for us to focus on the financial stability of our agencies, wages that will keep our workforce in home care over fast food and retail, and bring back access to care. It is time for us to expedite eligibility for those in need of our care without several trips to the emergency room at the taxpayer's expense in order to stabilize their post-acute needs that can be provided at home. It is time for Rhode Island to be no longer out of parity with neighboring Connecticut and Massachusetts reimbursement rates. It is time to save home care. It is time to save home care, and it is time to finally pass House Bill 7728 and Senate Bill 2557. So you've heard enough from me. And if you don't like how I present myself, you can blame Rep. Amori. Let me transition. Over the past few years, we've honored great legislators that are leaders fighting for home care and hospice every day. We honor those that have committed their political careers to advancing quality health care at home, like the late House Majority Leader Thomas Lamb, such as Representatives Joe McNamara, Eileen Naughton, Frank Ferry, and Scott Slater, as well as Senators Jamie Doyle, Mary Ellen Goodwin, and Lou DePalma. Today, we're grateful to honor 2 more legislators that are home care and hospice advocates seeking to improve access to quality home health care services. Both legislators have strong records that demonstrate their longstanding commitment to making health care in Rhode Island go from good to great, and are in key positions to influence debate on how to more cost-effectively provide care to our state's oldest, poorest, and sickest populations without jeopardizing the quality of care that they receive. We appreciate their continued support and advocacy, and in turn, continue to support them here at the State House and in their respective districts. Both legislators understand the need to support home care agency staff by providing competitive salaries and benefits, which can only be done through adequate reimbursement rates, and are working with their respective chambers' leadership to leverage support for the partnership's proposed state Medicaid rate increase for home care services in the FY17 budget, to expedite eligibility for all those in crisis, and to prevent bad policy that will lead agencies to abruptly closing their doors. On behalf of Rhode Island's home care and hospice providers, I'd like to thank the 2 of them for their support for our agencies, our staff, and our patients and clients we serve. I am proud to present to all of you State Representative Joseph Circacci and State Senator Erin Lynch Prada, each with the Rhode Island Partnership for Home Care's 2016 Legislative Champion Award. Would you like to say a couple words?
First of all, for having us here today and for everybody coming out here today. I know it's not easy to get up here. Everybody has their own lives, their own families, and certainly you're all here to help take care of everyone else's family. So I just want you to know that both Representative Circacci and I and the House and the Senate take very seriously what you do. We take very seriously the fact that you're here and that you're concerned about not only your wages but about everyone else's family. So we're listening to you. We hear you. We know that there are obviously 2 bills, one in the House and one in the Senate, that you're looking to help you guys increase your wages and allow you to live while you're taking care of our most vulnerable population. So I just want to thank you not only for having both of us, but to be here and to advocate for yourself.
Thank you. Thank you. I want to also echo what Senator Lynch has said. You take care of the sickest, the poorest, the most neediest, and you really do God's work. So I want to thank you for that. I had both a grandmother and a mother who needed home care, so I understand the plight and the role you play, and I sincerely thank you. I want to thank Nick, your advocate here. He's outstanding. He works very hard for you every single day here at the State House, and we are going to do our very best to make this a reality. Thank you very much.
Before we conclude our program, I want to encourage all of you to talk to your state legislators while you are here today and encourage them to speak with Speaker Mattiello and Senate President Paiva Weed about making adequate and reasonable funding for home care a priority. For home care a priority for passage in this session. If our message has moved you to take action, please use your social media to contact your state legislators using #SaveRIHomeCare. For those of you watching on Capitol Television, if you or a loved one is seeking home care or hospice services, please contact the Rhode Island Partnership for Home Care at 401-351-1010 or log on to www.riphc.org, or you can follow us on Facebook and Twitter at RI Home Care. Thank you all for attending the Rhode Island Partnership for Home Care Care's 2016 Home Care and Hospice Lobby Day. Thank you.